Hello and welcome to today's Swedish Facebook Live. I'm Mona Locke. I am Chief Communications Officer here at Swedish, and we're the largest nonprofit healthcare system in Washington State with 5 hospital campuses, 115 clinics, and 2 freestanding emergency departments. And we started bringing you these Facebook Lives to really help the public get the information you need about the latest on COVID. So please remember to chat in any questions you may have, and we'll try to answer them real time. This week's topic is, I think, a very interesting one because it focuses on the community, the vulnerable communities out there. And really, we hear in the news, the national news every day about how this community has been impacted the hardest in many ways, and there's shortages at the food banks and a lot of things out there that perhaps we, the public, can help with and we, at the very least, should know about. We'll also focus during our time together on the recovery phase and what hospitals like Swedish are doing to get the public prepared to feel safe coming back into our clinics and hospitals should the need arise. So I'd love to start today with our introductions from our guests. First, let me introduce Sherry Williams. If you could really tell me about your title and what you do for Swedish.
Hi everyone, I'm Sherry Williams. I'm the Regional Director of Community Health Investment here for Swedish Medical Center. And my role really supports the many community partners that are in and around our hospitals. Those partner organizations support and educate their collective individuals. We, as Swedish, provides health and wellness, prevention information and education. We also provide funding and investment to our community. And then we also identify what's the greatest needs for the most vulnerable populations that we serve.
Thanks, Sherry. And so you're really out there, at the forefront in those communities. So we appreciate the work you do. Next, I wanted to introduce Dr. Michelle Arnold, if you could take a few moments to talk about your space.
Thanks, Mona. My name is Michelle Arnold. I'm a specialty neuromuscular medicine physician, but this season I'm a COVID physician. I've been here with Swedish for about 7 years, and I'm helping operationalize our mobile COVID screening unit.
That's right. It didn't exist at all before. They were our mammography units. And then tell me how those are staffed. I mean, we have actually these mobile units that go out into the community.
So Hope, and the name of our coach is Hope, so we call her Hope, kind of colloquially. She was the inspiration for this mobile COVID screening unit, and formerly a mammography coach, obviously impacting different communities that may not have access to care, and it seemed like a really natural transition to take this coach and use it for COVID screening and testing. So we take Hope with us several days a week to destinations throughout the Puget Sound area and set up basically a field clinic. We set up tents, we set up equipment, and then we see multitudes of people right there in their neighborhood and community. So they get access to care for COVID.
That's great. We'll talk more about that in a little bit. But our final guest I wanted to introduce was Dr. Chris Dale.
Hey, hey, good afternoon. I'm Chris Dale. I'm a pulmonary and critical care doc here at Swedish. I also serve as our Chief Quality Officer. So in that capacity, I work with a great team of people to work on stuff to do to make Swedish safer and provide even higher quality care. So just happy to be here and talk a little bit later on, I think, about how things that we're doing in that vein, things that we're doing to make Swedish a safe place to go and get care these days.
Perfect. Thanks, Dr. Dale, for joining us, and thanks to all of our guests. But I want to start out today with first asking Sherry a question. You talked about helping the vulnerable populations and communities. Can you expand on that? How would you define a vulnerable community?
Well, first of all, as a patient, you are in the most vulnerable state you can be in a healthcare facility. Many of our patients are limited with regards to access to care. And when I say that, they may come to us that are homeless or unhoused, maybe food insecure, probably speaking another language other than English, seniors, those who are suffering with mental health or mental illness issues, chronic illnesses, or any underlying health issues. Living outside of the urban core could be an opportunity to be considered as a vulnerable population. We do look at it as social determinants, those barriers that limit individuals and groups to have access to resources and support. So the communities that we serve and Swedish aligns with really share with us, and we listen to what their main health issues and community issues are, and then we access and try to fill the gap to support what those needs are in a very collaborative way. So again, we look at many populations and communities as vulnerable because they are very different aspects of what that means. We again listen and we survey and we understand what those health issues and risks are, and then we support and supply resources to combat those issues.
And Sherry, tell me a little bit about how that landscape has changed when COVID hit in these communities.
Oh, absolutely. When we say we're in this together, consider that we had a population that was already struggling, and now they're really at their most vulnerable. So we see food insecurity as one of the major issues that is due to COVID that people are struggling with. Hot meals, food banks, groceries is one of the big issues. Homelessness and being unhoused is another major issue. And we're working with community partners to try to support with rent relief, providing PPE and resources to many encampments or transitional housing units. We also see those that that do not have English as a second language. So we are partnering with the International District, the Latino District, as well as the Somali and the East African communities to translate information from public health to them that specifically talks about the requirements with distancing and quarantine and separation. Those key laser-focused initiatives support the communities where they are, and it allows them to have access to quality care, resources, and a connection back into the healthcare system.
Well, that's a lot of work. We want to thank your team for everything you're doing each and every day, especially during this pandemic. And Dr. Arnold, can you talk to me about how the mobile units now fit into helping these communities?
Sure. So the mobile units seek out these isolated, marginalized groups to meet those individuals in their community and provide the screening and testing. So organizations that we partner with create a list of those who might be in communal living settings or in homeless encampments. We visited a number of tiny villages. Imagine, living in a space smaller than the one I'm sitting in now, with no ventilation or windows, with others who might be sick. So we take our staff of nurses and medical assistants and customer service agents, and we set up shop basically on the sidewalks and in the community around these communities, meeting them kind of right in their space. That helps us to really connect with those who might have fear about stepping across that boundary into the healthcare system. And we welcome them in, and one-on-one, they each get a moment with nursing to go through individualized plan to help keep them safe in their own environment. And we think that's one of the most important pieces that we do in addition to testing.
What has it been like? I mean, has there been a good reception to that and they feel safe? And do you have any idea of how many tests you guys have done?
Sure. So across our community resource clinics, we've had approximately 6,900 screened and around 3,900 that we've tested. And the response has, for the most part, been overwhelmingly positive. People feel that finally someone's listening to them, someone's reaching out to them. But it is a challenging community. One of the jobs that we face in a lot of these settings is bystander safety and passerby management. We're in settings with folks who have behavioral health challenges. Some arrive to our screening site impaired, and trying to manage a lot of those elements while keeping them safe and just curious onlookers safe, as well as keeping our caregivers safe, has been a real challenge, but actually really rewarding.
And I want to bring Dr. Dale into this too. We're talking about the safety, and some of these, the people in these communities end up in Swedish, along with all of our other populations out there. And Dr. Dale, I know that we're working on plans in this recovery to make sure everyone feels extra safe and that we're taking care of not just our providers, but our caregivers. And can you give us some more information on that?
Oh, sure. Yeah, I appreciate that. Actually, as Michelle was talking, and even as Sherry was speaking, like I reflected that Swedish does so much stuff, we're a big organization, I guess. We got 10, 12,000 caregivers that work with us, and 5,000 odd providers, and there's so many different things that are going on. And during the times of COVID, we used to perform between 120 and 160 different surgeries a day. And we saw those numbers when the governor had his order kind of cut back to only essential, only urgent and emergent surgeries. And that number kind of went down to 20 or 30. We're still caring for strokes and heart attacks. We're still caring for stuff that's emergent, but a lot of the things that people have been kind of like fretting about, people have been delaying getting health care. And that's really been kind of sad because we're seeing the effects of it. Like people are kind of delaying going in for checkups and delaying getting procedures. So as Washington gets going again, as we're restarting Washington, here at Swedish, we're looking to make sure that we can make this environment as safe as possible. And I'd say kind of there are three categories of things that we're doing. One, we put in place a lot of, I think of them as engineering controls or ways that we're keeping our environment safe. So if you're coming to a Swedish facility, like you saw us all kind of start off wearing masks, like you'll see caregivers wearing masks. You'll come into a hospital and you'll be screened for your own safety, and people ask you about symptoms of COVID and even take your temperature. Like we're physically at First Hill right this sec, and in order to get up to the room where we're in, I had to get my temperature checked with this no-touch thermometer thing. Because we don't want people coming in who have fevers. And then inside our facilities, we're taking a lot of thought around social distancing and making sure that people wear masks and really trying to keep our environment as safe as possible. So that'd be the first category of things. The second, we're beginning to schedule, starting May 18th, a lot of procedures. Because that's the date on which we'll be able to start doing elective procedures again.
We think.
And yes, it's tentative. Yeah, thanks, Moni. I appreciate that. And so in order to make that as safe as possible, we're working through how will we do testing to make sure that we're not bringing people who actively are affected with COVID-19 into our facilities. So working through the logistics of being able to test everyone who comes into Swedish for a surgical procedure. And then so testing is the second bucket. And then the third is actually kind of a proactive one, and this is one that's near and dear to my heart because as someone who thinks about quality a fair amount, kind of our having things that we do proactively to go and kind of test to make sure that we are being safe. So like proactive safety rounds occurring frequently in our facilities to identify areas where we can improve. That's been something that we've kind of doubled down on during COVID and it's been really successful. So there are a number of different things that we're doing to keep our facility as safe as possible, but that not waiting for care and coming in if people are sick or need care, I think that's a really important point to underscore with folks.
And are we also thinking about separating the COVID patients from the general population to make sure that there's no interaction?
Yeah, and so from the beginning of COVID-19, on the ambulatory side in our clinics, and then also on our inpatient side of our operations, we've created designated COVID areas. And so, for example, like if you have COVID and you need to be hospitalized, you'll go to certain geographic areas. We actually did a recorded Facebook Live a couple of weeks ago where we took people on a tour of what the Issaquah ICU one looked like. Just to give a sense, because sometimes it's hard to, as you're kind of just describing it in words, it's hard for people to kind of know what that is. But they're just the set aside geographic areas where, let's say, there'll be negative pressure airflow so that that it minimizes the risk to caregivers. Everyone who cares for COVID patients will wear the appropriate universal precautions: the gown, the glove, the mask, the face shield, et cetera. So we've really kind of put in place a lot of in the profession they're described as engineering controls, but we put in place a lot of things to make the environment as safe as possible.
And we'll try and post that link to that inside the ICU tour on this chat box. Also, Dr. Arnold, when we're talking about those safety protocols within the hospital, how do you replicate that outside? And I believe you have tents that you set up with your COVID mobile units. How do you make sure everyone is safe on both sides, the provider and the patient?
It's a great question, Mona, and it's something that many of us keep at the front of our minds at night when we're not there, as well as while we're on site. So the Centers for Disease Control have actually recommended that if we do any sort of swab testing, that we do that outside. These tight spaces with walls and poor ventilation, it's a great way to trap in those respiratory droplets that you can't see that are the cause of transmission. And so we set up tents where we've got a lot of airflow, and we're outside with swabs that look like this. This is a nasopharyngeal swab, and this is for one specific type of COVID test. We basically put anyone who's within 6 feet of a person who's undergoing screening or testing in full protective equipment, which means they have a gown on, they've got an N95 mask with a surgical mask and or face shield covering that. And then they have sometimes one or even two sets of gloves, and those gloves get exchanged out between each patient encounter. We wipe down every surface that might have seen respiratory droplets during this procedure, and then wipe down all of the chair that the person was sitting in. And then even the kit that we use to send to the lab, there are certain ways of handing that off so that we can maintain as much protective precaution so that we don't transmit those droplets to one another or to the next patient that we see.
And not just with those mobile units, we also have our COVID drive-through resources testing. And so I'm assuming some of those same protocols are taken at those drive-through sites?
You bet they are. Actually, a drive-through site is a really innovative way to meet patient needs. Having someone come into our building puts us at risk and them at risk. And so meeting them in the space where they are makes it more comfortable and actually safer for them and for us.
Yeah, so, and then Sherry, for those in those vulnerable communities, what do you see as their greatest challenges these days?
Well, Dr. Arnold mentioned the protective gear. We actually have the opportunity to work with our internal supply chain and to identify additional PPE that we can donate out to the community. And so we have provided masks, gloves, alcohol wipes, and hand sanitizers to our community partners so they can feel comfortable and safe living and working in their communities. So that is really one of the biggest needs, that protective gear. We also see the greatest need is food insecurity and the opportunity to feed the communities that we serve. My team has been redeployed, the meal donation line as well as the PPE donation line, but we also have a community volunteer time donation and labor pool. And so actually connecting our communities to what they would want to do and how they could help and give back has been a great resource. So we have this one program with the residency clinic that we are engaging our community volunteers to go out grocery shopping for them. We provide them with protective gear, instructions, following the correct protocol. We provide them with shopping bags that they drop off at the patient's location, and then really communicate with them through phone. And so we are looking at ways to be innovative and strategic and filling the gap of what our community needs are. And as I mentioned, food, housing, meals, companionship, having someone talk with our patient populations and to be able to make those connections. But with regards to our community partners, really working with providing them with a resiliency fund investment that really triggers the COVID response that's needed right now. We're reaching out to community partners that identify domestic violence or women and baby care. So we are really surveying and reviewing our list of community partners and focusing in on the top 5 or 6 vulnerable population and issues that is very important to us, and partnering with them. Relationships are everything.
So when you're talking about the community partners, just to define it, we're talking about like nonprofit organizations that are in those communities helping certain categories of vulnerable populations.
Absolutely. Those nonprofit, we've had relationships with them for many years. We know the populations they serve, and we also know the leaders and program managers of those nonprofit organizations. And we work closely with what those specific needs are that's supporting the communities with regards to this COVID virus. But also, we're looking deeper to help sustain and really develop these recovery action items that will help support these organizations in the future.
And it's a great topic because I know that we at Swedish have received an outpouring from the public of like the PPE and the food donations and everything, which we really appreciate. But so say I'm at home and I say, you know, I want to help those populations that need it the most. What would you recommend that they do?
Well, again, this outpour of generosity has just been incredible. Helping your neighbor, I think, is the number one thing you can do in this time of need. Reaching out to your neighbors, and then maybe doing something unusual and out of your comfort zone. Go to the communities that you may not have had a relationship with and ask how you can help. I also recommend reading on video, checking in with seniors. But I also say take care of yourself. I think the top of most is to have that self-care, and if you're in a good place in your life, you can give back in so many different ways to others. So again, mental health, mental illness, reaching out to your neighbors and family members, giving back in many different ways, and develop those relationships that can be everlasting with your community partners and those that are close to you.
And as COVID has kind of changed our communities forever in many ways, I am assuming we need to continue those efforts even past like when the governor lifts his restrictions, right?
Mm-hmm. Absolutely. I know that the world's going to be very different when the systems start to reopen, but the key is to identify what has worked during this time frame and see if we as a collective group could extend those relationships. Many barriers have been eliminated through housing and food and outreach, transportation, and other methods. Let's work collaboratively and strategically to continue those resources for the betterment of all.
No, and that's a great message, and I think there's a lot of resources online too. If you don't know your local nonprofits that are working in your community, it's a great place to start, or you can always feel free to reach out to Swedish, and we have our donation email address. But also I want to talk to the other panelists today about like, how do we continue into the future? So for the mobile units, are we going to continue those, or what will be the next iteration?
So Mona, we're planning to continue the mobile units as long as there's a community need for them. Unfortunately, there's also a community need for breast health, so those mobile mammograms are going to need to get done as well. So we're actually partnering with other nonprofits who may be able to step in kind of behind us and backfill that need, because many of us actually have day jobs that we have to get back to, and as things start to open back up, we're going to get called back into those roles, and so we're looking at the ability to hand off to those teams. We're also preparing for what could be a surge of COVID infection again this fall. We don't know what that looks like yet. We're listening to health leaders to give us guidance and information, but we'll be ready at hand when we're called on again.
No, that's a great point. And Dr. Dale, I mean, I'm going to toss it over to you in terms of what are our expectations or thoughts around, we hear the flu season may kick up again in the fall, and we may have COVID and a potential another surge. How do we plan for that?
Oh, that's such a good point. I think Washington State's lucky. Like, the Institute for Health Modeling, and coming out of UW, like there have been a lot of great models that we've been looking at here. And Swedish is part of the bigger Providence system. We have some internal data that we've looked at to try and forecast that exact question. What does the fall look like? And the final truth, I guess, is that we don't know. We won't know until we get there, and so we kind of need to be prepared. And I think Governor Inslee's done a great job in terms of instructing healthcare systems to make sure that we have sufficient reserve capacity. They say, we need to be able to surge up 20% in terms of getting new COVID patients in. And Swedish is ready to do that. Like if we were to experience kind of a dramatic uptick, kind of like Michelle was alluding to, we could meet that need. We have enough ICU beds, we have enough personnel, we have enough physical space and ventilators and stuff, and we'd be able to meet that need. So we're prepared for the future, kind of whatever it may hold. But we're hoping it doesn't happen, and that as we gradually relax social distancing and people are able to get back in and receive the care that they need, that we're able to kind of get back to our new normal.
It's great that we have planned and we didn't have the extreme surge that we thought we would, but we know we're prepared. I like to do the round robin and really give for each of you to give the public your best advice from your perspective. Dr. Dale, I'll start with you.
Okay. Well, two things. One, it's the 200th anniversary of Florence Nightingale's birth. It's the year of the nurse. And so I just want to say thank you. It's Nurses Week right now to all the nurses here at Swedish and across Washington State who provide just such outstanding care and really kind of are the heart and soul of healthcare delivery. As a son of a nurse, I'd say thank you. So that'd be the first thing. The second thing is don't wait. If you have healthcare needs, please come and seek care. We're seeing people delay getting care for heart attacks or for strokes or TIAs, and we're seeing the effects of delayed care. So please, the healthcare system, the hospitals are safe places to get care. Please come and get care.
Well, I'm going to just kind of veer off on that. If I don't want to come in a clinic and or the hospital and I have a question for a doctor, we have virtual health, telehealth.
Yeah, that's been, I think about like silver linings of COVID, like great things that have come out of this. And there's so many things, like kind of the community spirit that Sherry was talking about. But one of them is virtual health. And so if you go to the Swedish website, swedish.org, you can see a link to how to get virtual care. And our virtual visit volume has increased by like 10,000% over the course of the past several months. It's been terrific, and so we're hoping that continues. Like we're talking to the federal government and really lobbying that some of the cool things about being able to provide care virtually become the new normal. So we're really excited about that.
And we are enacting that, so someone could reach out and get some advice through our virtual care system and telehealth. So, Dr. Arnold, final words.
So I think the best advice I can give is to continue to think wisely and use caution appropriately. As we start getting back out into the community, we're going to start feeling more and more secure with one another, but that doesn't mean that we're out of the woods yet. And it's a really easy time to let your guard down. And that's when it's going to be really important to use things like this, your mask and hand washing. And when you don't have soap and water, hand sanitizer. Make sure that you continue to maintain distance and, try not to touch the outside of your mask and then touch your face. These are all kind of the basics of how to protect yourself from getting infection. And that will continue probably through the better part of the summer and maybe into the fall.
If not forever, really. Sherry Williams?
Well, I would say Swedish will continue to be your partner in the community. I feel that relationships are everything. Develop those relationships now. Continue those relationships with those in your communities that are vulnerable and that are isolated. And bring your best self to the table. Bring the gifts of who you are. And believe me, that is the best way to make sure that you are making those connections to so many in our community. So be present and be aware, be safe, but stay connected.
I think that's wonderful advice from all three of you. Thank you, panelists, for being with us today and sharing your insights. And I would also add that just the masking is so important. And if it's not necessarily for you, it's for everyone else out there to really respect that we are keeping our germs to ourselves and not passing anything. So again, thanks for being with us and appreciate it on behalf of Swedish. Have a great day.